Yes, I advocate the two things, okay? I advocate for prophylaxis and early treatment because that's how you're going to make a difference in this disease and in the pandemic. Because another thing, our hospital protocol or our hospital treatment for the very sick one is very flawed.
Do your share. Don't throw garbage anywhere. A reminder from LR Cares. Stocking water is a must. Tanke is here. Locally produced. International quality. Tanke.
Dow imported. Nature's Perfect Lunchbox. For perfect eggs, fresh and clean, guaranteed all the time. For orders, text or call 0907-838-7958.
We have here a Filipino doctor based in United States, Dr. Marivic Villa. Doc, good afternoon.
Good afternoon. Good afternoon to you and to everyone.
Yes, Doc. First of all, how do we begin to make sense of what is happening now?
How do we begin? That's a very good question. The main thing that we have to be concerned about actually, or make sense of it, is to reduce the fear. You know, I know this is a real pandemic. You know, we have problems. There are people dying. But people have to realize that this disease is very treatable, very preventable, and we have to focus on that so that the fear of people comes down. And when your fear is down, everybody thinks much better, and we can make better decisions. And so that's the first thing that we have to do. And when I say treatment, early treatment, actually, we shouldn't allow the patient to get very sick, and then that's the only time we intervene. The key to making a difference in this pandemic is actually through prophylaxis, prevention, okay, and early treatment. Because if you allow the patient to get very sick, and that's the only time you do a real intervention, sometimes it's very late. A lot of times, actually, it's very late, and the patient dies. And then it's like a cycle of fear and then worries again. And then when you have fear, people don't think clear, and they will just do everything and anything which they think will save them. You know, I'm glad you interviewed me like this so that I can tell the people that really we have to decrease the fear of this pandemic. Yeah.
Next, Doc, is the newest variant. There are a lot of variants that has been existing all this time. It has alarmed our business. What is your take about this?
Yeah, the variant, there's going to be always a variant that will come out. You guys have to realize that this is one, it's the nature of the viruses, the nature of coronaviruses. They will come up with different variants, but we cannot be so fearful again, the idea of having a new one. We wouldn't even know what this one can do. And again, having a variant, I know you haven't asked me a question about vaccination, but one of the major driver of variant formation or evolution is actually the vaccine. Because it drives the mutation faster. Usually, the coronaviruses or any viruses, they mutate randomly, and that's a natural process. You know, it's not the goal of the virus to actually kill the host, because they only have two things in their existence, if they're even alive, is to infect and to replicate. So that doesn't make sense that a virus will kill the host like right away, and then that's going to exterminate them. But so they mutate, and usually, this is the good news, they mutate to become more infectious but less virulent or less dangerous, or it doesn't create severe diseases. That's usually the case. But when we have the vaccination, the way that these viruses mutate is to the point that it will avoid the antibodies of the vaccine. And so in essence, you create actually a variant that could be more virulent or more dangerous and then more infectious. So in the process, it's like it will come out always like a novel virus. And that's the time really that we have to worry about. The vaccine is a very unnatural intervention in a pandemic like this. And to me, the way I look at it, if you allow the pandemic to run its course, because it's going to come back over and over again, that's the nature, and you take care of the people, the infected one, we know very well that the mortality rate of this virus is like what? 0.5 to 1%. So 99.9 survivability. And so if we just take care of the very sick, we protect them, we treat them, and we actually anticipate, for them not to die, I mean, we really are in good position. But now they introduce the vaccine that has its own injury and complication, and they're not being transparent about it. They don't tell us what can the vaccine really do, because the vaccine, we know very well, it doesn't prevent you from getting infected, it doesn't prevent you from transmitting the disease, and we know that it actually drives the mutation faster. So there will come a time that if we keep on vaccinating, and this is my opinion, okay? If we keep on vaccinating, we're gonna come up with a superbug that will not respond to the treatment that's available right now, including ivermectin. As you can see, I'm wearing this t-shirt. I'm a very big proponent of ivermectin used for prophylaxis and early treatment. And so,
can you tell us also about yourself and what made you interested in this pandemic?
Let me reintroduce myself. I'm Dr. Villa. I'm a practicing internist in Florida. The town is called The Villages. I have a specialty in pulmonary critical care, sleep, and I have a background in functional medicine and nutritional medicine. And obviously, I'm a practicing pulmonologist. Most of the COVID cases, they have problems with the lungs. So whether I like it or not, I'm going to be involved. And one thing, I practice in a community or a town that is actually heavily concentrated with retirees, meaning they are 65 and above. In the U.S., 65, they are retired, they're under Medicare, which is the insurance for the older folks. And they have comorbidities, they have a problem with obesity, they are taking lots of medication. So what I'm trying to drive at and trying to say to you, I actually take care of a population that's the highest risk that you could ever find. Okay? And so right now, I started treating them, or at least I started using the ivermectin like around August of last year, 2020. Since then, or at least around since September, I haven't had any hospitalization. So when there is no hospitalization, that means there is no death. So that's my record. Okay, and I've treated so many. I've treated several thousand. And then I've treated people also here in the Philippines. I help, businesses, LGUs, I guess, that's how you call them. And we've protected quite a lot of people. I can say it here unless you want to ask me how many. You want should be more between 30 to 50,000. Yeah. That's a lot. So that means a lot of lives saved. I mean, it's a treatment between early treatment, the quarantine, and actually prophylaxis. So when the infection rate in the community, you use prophylaxis so that you don't get a lot of infection. And that's what I do with my population as well. I have between 12 to 15,000 patients under my practice. And majority of them, I would say 80 to 90%, it's either they're taking prophylaxis or I've treated them already. In Florida, obviously, that's the US, we have more resources. So when the monoclonal antibody became available, I started using it since January of 2020. The more that I don't have sick people, all they have to do is come to the office, they get tested positive, and I treat them right away. And so,
And
that's that.
how much have you learned about this disease?
How much what?
How much did you learn about this disease?
We learn a lot. I think this disease is something that uncovered or opened a lot of things from the way we practice medicine, from the way the government actually behaves. Because with this disease, I think, I mean, I could be wrong, but I think a lot of corruption became uncovered. It also made us learn how are we going to behave in such a thing like this in terms of our, economy. I mean, after the disease or this pandemic happened, the approach or the authority, the healthcare authorities, we can tell now, or we can look back, that it was a mistake. There were a lot of mishandling the pandemic. There's a lot of mishandling because people came out sicker, to me, again, and came out poorer. Poor and sick, they don't go together. You're going to kill them. Not even with COVID, but by just the condition that they're in. When I say sicker, because psychologically, the entire situation is very difficult. I mean, how can you be happy when you cannot even meet the basic needs? Nothing to eat, nothing to provide for the family. And that happened. And people are not looking at the collateral damage that happened. Like, let's say, for example, more hungry children because of the lockdown, because of the restriction here. And then, to me, really, this mandate of vaccine is another insanity. It's an insanity to the max. Okay?
Why is
And,
that though?
huh?
Why is that?
Why is that? Number one, when you mandate an experimental vaccine like this, you are violating the human rights. Okay? It's a violation of the human rights. It's unethical. They are not proven. So that means that we are still in an experimental stage. We don't know what it can do, what harm it can do. And the thing is, we have so many vaccines already been given, and up to now, they don't want to tell us what is happening. At least they can pause and actually tell the people how many are dead, how many are injured. And we do have that. I treat injuries from the vaccine, and I have dead people from the vaccine. And so they're going to tell me, even though I only represent a segment of the population, but if you look, overall, people are telling their friends, their relative, my aunt, my dad, my mom, my cousin, they died from the vaccine. And nobody is listening. I think the authorities are sweeping it under the rug. And that is very bad.
Do you think they're also lacking transparency here?
Yes, that's the whole thing. Because it's not only lack of transparency. They have willful blindness. They know, but they don't want, they pretend that they don't see it, and they deny that it's even happening. And so, what else? Why is it bad? Right now, they're vaccinating the children. How are you even going to justify that? What is the mortality rate of children? The one that they're vaccinating right now, 1 in a million? How are you going to justify the benefit? We don't vaccinate our children to save our old people. I'm not saying that I don't love the old people, but you don't do that. You vaccinate because you want to save you. You're the one getting the vaccine. It has to be for your benefit, and not I'm going to be vaccinated and it's for the benefit of my grandpa. No, that cannot be. I mean, you ask me, who am I going to sacrifice, me or my child? It's going to be me. Even though I'm not that old, I'm actually very productive, person in the community. But if you ask me, my child is going to be saved. Nobody's going to touch my child. And then, we have complications. If it is happening in adults and grown-ups, it's going to happen in kids. The thing is, if they don't die right away, they are going to have a difficult process in life because they're going to be growing up sick. There are already signals that we see. The vaccine can potentially cause a lot of autoimmune disease. There are already signals that it can actually cause cancer. It's not going to happen right now. It may not happen 1 year or even 2 years. How about 3 years? How about 5 years? How about 10 years? There are already so many signals that we can see. Even myself, I'm seeing it. Somebody who already has a history of autoimmune, few months, few weeks after the vaccination, they come to me and they're flaring up like crazy. What's going to happen to the quality of life of this patient? What's going to happen? The people, younger people like you, young men, the myocarditis, the pericarditis is the inflammation of the heart. And then there's enough cases, but they don't want to show it. What's really the real figure? To me, even if it's 1 in, 100,000, it's not supposed to happen. When it's not supposed to happen, even 1 case is going to be a lot. Okay? But it's more than that. We're talking about 1,000. Even if, let's say the acute symptom or the acute complication of the vaccine resolved, we don't know what we're looking at down the road. And that's actually what I'm scared about. I'm scared about that because we can end up having so many young people debilitated and disabled. To me. Okay? I hope that doesn't happen. Obviously, it's like you're prophesizing something, but it's not a prophecy. I can see it. I'm a person of science. I'm a doctor. I see people day in, day out. And I see the cases, what is happening. I analyze their blood tests. I analyze the clinical symptoms. I correlate what's happening now with what they have before. So if people do not, the authorities, the so-called healthcare authorities, I think the blood is in their hands. They have blood in their hands. And then they are refusing the early treatment and prophylaxis like this medication. The ivermectin is a very viable option for Filipinos because we don't have all the resources here. Just like, as I said, in the U.S., we have more. But this one, anybody can produce, and it can be distributed very easily. Even if you tell me, okay, it will only save 50 or 60% or even 30, 40% of the cases. For a deadly disease like this, that's high. I'm going to accept it. And it's very, very affordable, cheap, and it's very safe. And it's proven already. This medication is a repurposed medication that has been available for the last 40 years. And then for these people to give out this misinformation, disinformation, that the medication doesn't work, that the medication is actually risky or dangerous. No, they're lying to you. They're lying on your faces. It's been available it's worldwide, basically.
So basically, you advocate for the use of ivermectin.
Yes, I advocate two things, okay? I advocate for prophylaxis and early treatment because that's how you're going to make a difference in this disease and in the pandemic. Because another thing, our hospital protocol or our hospital treatment for the very sick one is very flawed. It's very flawed. It's not only very expensive, but it's toxic. Okay? It's very toxic. It kills people. You don't die from the COVID, you die from the treatment. And I've seen it over and over and over again because I try to help people. I'm not saying that it's not happening in the U.S. But at least over there, we fight. We really fight. Here, you go into the hospital, it's a requirement. It's saying, we're not going to admit you here unless you agree that you are going to receive remdesivir or tocilizumab or whatever hemoperfusion they are using. But the tragedy there is doctors treating COVID here, when they are outside of that little protocol, at least the impression that they're giving me is they don't know what to do. They don't know what to do. Because I tried to help them, and the thing is they don't even want to talk to me. But
Is it controversial as well to talk about vaccine or other COVID medications? Why do you think is it controversial for people to speak about that?
to speak about the vaccine, because it's the narrative that's going on. That's what they are. There's a difference between what they are saying and what is actually happening. You know, what is happening, they don't want to hear. From the very beginning, they have this narrative that this is what's going to happen, mass vaccination. Everybody should get a vaccine on their arm. And nobody deviates from that at any cost. That's what I see. And so it's controversial because they're going to take you down. If you start talking, I don't know what's going to happen to this interview. Are they going to start shooting me? Possibly. But I'm not going to stop talking because they question me. I have the experience. I saw the cases. I still see real cases. Both the natural infection and the vaccination. And actually, at one point, they merged that I cannot tell anymore which one was the complicated natural infection and which one is the vaccine.